And in this lecture number 2, I will discuss about the kidney stones. As you already know that kidneys clean the blood by removing harmful substances from it, they pass the removed substances out of body through urine. Sometimes the filtered harmful substances such as calcium oxalate, calcium and ammonium phosphate, and uric acid gather in kidneys and make large solid objects. As you can watch, these are kidney stones. These objects cannot pass in the urine, and some stones may leave the kidneys and may be trapped in the ureter or urinary bladder. The major causes of kidney stones are dehydration, high sodium intake, high dose of vitamin C, high urinary calcium, high oxalates, decrease in urine pH levels, high uric acid levels. And here are the foods that cause kidney stones, in which excessive caffeine, red meat, table salt, carbonated drinks, non-fermented soy, and excessive drinking, and oxalate-rich foods such as tomatoes are included. So, patients who are suffering from the disease that is kidney stones, it is forbidden to use the tomatoes and spinach in their daily diet, because these tomatoes are rich in calcium oxalate concentration. So here are the symptoms of kidney stones, that are severe pain in the side and back below the ribs, pain that spreads to the lower abdomen and groin, pain that comes in waves and fluctuates in intensity, pain on urination, pink, red or brown urine, cloudy or full smelling urine, nausea and vomiting, persistent urge to urinating more often than usual, fever and chills if an infection is present. And sometimes the pus and blood is seen in the urine of the patient. About 90% of all kidney stones can pass through the urinary system by drinking plenty of water. In surgical treatment, the affected area is opened and stones are removed. So, lithotripsy is another method for the removal of kidney stones. In this method, non-electrical shock waves from outside are bombarded on the stones, as you can watch here. These are ultrasound shock waves. So, in this urinary system, waves hit the dense stones and break them. Stones become sand-like and are passed through urine. So, lithotripsy is the method to remove kidney stones. The next disease is renal failure, and it is a condition in which the kidneys fail to remove metabolic waste and end products from the blood and regulate the fluid, electrolyte and pH balance of the extracellular fluids. Kidney failure means a complete or partial failure of the kidneys to function. So, here are the causes and reasons behind kidney failures: heart diseases, drugs and alcohol, diabetes, kidney stones, cervical, and dehydration. This cervical is new for you, so it is a common age-related condition that affects the joints and discs in your cervical spine, which is in your neck. The major symptoms of renal failure are high level of urea and other wastes in blood, excessive amount of urea in blood, high concentration of body fluids, nausea and vomiting, swelling of face and feet, weight loss, and blood in urine. Renal failure is also caused by diabetes, that is hypertension, that is high concentration of blood sugar level, high intake of aspirin, high intake of ibuprofen and cocaine. So that was all about causes and symptoms of renal failure. So here are your home tasks for the day 1. You have to write the functions of kidneys including pressure filtration, reabsorption, tubular secretion and osmoregulatory functions, and you have to write the causes, symptoms and treatments of kidney stones, and you have to write about the symptoms and causes of renal failure. That's all for today, and you have to memorize all the concepts from textbook pages 24 to 27. Day 1 tasks completed. Thank you and have a nice day.